class. So in this video, I want to discuss some of the most significant child welfare laws that have passed in Oregon and what the state of child welfare systems is in Oregon today. So I first want to focus your attention to the Oregon Revised Statute, which is 419B and parts of 418. So this is where you're going to find Oregon's Juvenile Code for Dependency and Abuse. You can Google it. It's pretty easy to find. In this statute, you can find all of our child abuse laws. It's where you're able to identify what constitutes child abuse and what laws DHS must follow within the foster care system. So I don't want to go into detail on this statute. It's really large. I just wanted to make sure that you all knew where it was and how to access it. A few of the laws that I think have had some significant effect on child welfare systems is what I wanted to talk about today. There's a few of them that I've pulled out. There's many that affect our system, but these are a few pretty significant ones that I think are important to know. So the first law is called Carley's Law. It was passed in 2007 by Representative Sarah Gelser. And what the bill does is first let's talk about why it was created. It was created because of a pretty sad situation out of Corvallis where a 3-year-old girl was repeatedly abused by her mother's boyfriend until he ended up killing her. So the signs of abuse were there, but the parents and the child welfare workers that were called out didn't see them, and the poor girl was never taken to see a doctor or trained professional who recognized those signs of abuse because they weren't obvious bruises and broken bones. They were more stress, trauma, and so because of that horrific event, Carley's Law was passed. And the main provisions of that law mandates that any child with suspicious injuries that are seen by DHS must go see a medical professional who is trained in child abuse within the 48 hours of DHS being called out to their house. So the law lays out what suspicious injury is, and it requires that all suspicious injuries that get taken to the hospital get photographed. It also requires that each county have a trained medical professional on staff to be able to look at those children and assess abuse. It also requires that a critical incident response team, which is called a CERT, do a report within 24 hours of the department determining that a child fatality has happened by child abuse or neglect, if that child was in DHS custody or if that child was subject to any child protective services within 12 months prior to the date of the death. So if CPS was called out at any time to see that family and then there is a death, then they need to investigate that report or investigate that death. So the goal of CERT team is to get together and review the case and reasons for the child's death. They're supposed to identify systemic issues that may have had an effect on the death of the child, and then there needs to be a report done. So there's been many of these, unfortunately, done since the bill's passed. They're pretty sad and extremely interesting to look at. You can see where systems have broke down, where different communication, think people should be communicating who aren't. It's pretty interesting to look at. If you want to, you can find them online. So the next bill I want to talk about is SB 1515 that passed in the short session of 2016, and it was created in the wake of a pretty significant scandal about a group home that happened in Portland, which I'll talk about in a few minutes. So that bill changed how the state regulated child caring agencies and how they respond to safety concerns and reports of abuse and neglect. So what it did is expanded the people that were covered under the rules by including child welfare and developmental disability certified foster homes and licensed developmental disability home facilities in investigations, just like for foster homes and different types of foster agencies. So the key provisions that this does is it doubles the inspection for all the homes that have foster children living in them. It requires the notification of all stakeholders who have children living in these homes when abuse has occurred. So that would be agencies like OYA, OHA, Proctor Home Companies, anyone that has foster youth that they place in foster homes would be notified when abuse has occurred in that home or potentially occurred. It also expanded the financial oversight from DHS when they're conducting reviews for these facilities. and requires that DHS staff report directly to the director or a designee of the director if they're concerned about a child's well-being in a child caring agency. And child caring agencies are non-governmental agencies. They're like youth programs, foster care agencies, day treatment agencies, things like that. So if a DHS worker is working with a child and they see a concern, instead of taking it to their direct supervisor or their district supervisor, they should have a process where they directly tell the director about it. The next thing I want to talk about is called differential response. It's not actually a law, but it's a policy decision that was made by the Department of Human Service in 2013. And it was a policy shift towards family preservation. And what it did was created a two-track approach to child welfare. So what would happen is a call would come into the child abuse hotline. DHS screeners would decide when a case comes through the hotline if they put that on the traditional track or the alternative track. So on the traditional track, Child Protective Services workers go out, they make contact with the family, they complete a comprehensive safety assessment plan, and make findings of substantiated, unsubstantiated, or unable to determine in that case. In the case of an alternative track, which would be differential response, is that CPS workers would get a notification. They'd have a certain amount of time to make contact with the family. They'd usually call ahead of time, schedule time to meet with the family to complete the comprehensive safety assessment plan. But that plan doesn't have to end with a finding like it does in the traditional track. The family also is given, since they're considered that they don't have an immediate safety threat when they're on the alternative track, they're offered voluntary services, but those services are mandatory, like they would be on the traditional track. And so the policy thought is that differential response would keep families together. If we could wrap them with enough services and catch them ahead of time, we could keep children out of foster care. So the program was implemented in a few counties, and the purpose of it and then it was supposed to be implemented statewide. But last year there was some controversy surrounding the policy based on an internal report that was done, where it stated that almost half of the cases reviewed in the counties who have implemented differential response showed that it was used when it shouldn't have been, and that the children in those homes were not safe because the families were not receiving both the needed support and services and kind of oversight from DHS that they should have been. So this report got to the state legislature. They had a huge hearing on DHS. They brought in the director. They brought in outside organizations that work with these families in the communities, and ended up writing a bill to put an end to DR in Oregon until some very specific requirements are passed. So the bill is SB 942, and it passed in the 2017 long session. And what it says is that before differential response can be implemented, the workload model for DHS must be staffed at 95% of the time, or 95% of the rate that they need. That screening must be centralized. That investigations have to be done within the mandated timelines, and that DHS must complete their face-to-face contacts with children 90% on time for 6 months at least, and that an investigation conducted by DHS must conclude always with a finding like it does on traditional track. So by putting these restrictions into law, DHS really had no choice but to discontinue the implementation of DR because they're not able at this point to meet those standards. And so the goal behind this bill was simple, that DHS needs to complete their basic casework goals before they can implement a new program on top of what they standard do anyways. And the last law, which I'm not actually going to talk about, it's HB 4009, and it could potentially have an important effect on the older foster youth in our care or in our system, and you're going to learn about that for your week's discussion post, so I don't want to talk too much about that. And the last thing is I just want to talk about where we are today with child welfare. It's gone through some pretty significant changes in the last few years. It was found in 2015 that a group home in Portland had embezzled millions of dollars from DHS and had left foster children in less than ideal living conditions. So the scandal unearthed some pretty widespread issues in the Department of Human Service, and it led to the director of DHS and the child welfare director to step down, and for SB 1515 that I talked about earlier to be passed. So at this point in time, DHS has a new DHS director and a new child welfare director who both started in the fall. They've been given the job of turning DHS around and setting it on a path to a better the child welfare system. The director comes from OIA. He has a really great history of turning that agency around, making it a more data-forward agency. And the child welfare director comes from, I can't remember what county, in Eastern Oregon County, and she was a district director there and has worked within DHS for a very long time. So, you know, it's not going to be an easy job, and it's definitely going to take some time, but there is trust in the new leadership to get it done. And so there's been a ton of reports that have been issued that address the multitude of issues that DHS has. And there's been different groups created, different things put in place to try to fix this. And so I just wanted to quickly talk about the Secretary of State's audit because, in my opinion, it's one of the most robust and newest reports that have been released. So you can find a link to the report and the press conference video in our material for this week. The report came out at the end of January, and it had some pretty troubling issues around the foster care system. Some of the examples are that, like, caseworkers were feeling neglected, they're overworked and understaffed, which we all know. The foster youth are living in substandard replacements and often in placements that aren't actually effective to their needs. That foster parents aren't getting the supports that they need, and that internally DHS is in a bit of chaos. So due to these findings, the Secretary of State came up with 24 recommendations, and I just want to go over a few of the important ones. The major internal recommendations were that they recommend that DHS improve their culture by creating transparency, responsibility, respectful communication, and professionalism, that they stabilize leadership change and ensure that central office and field offices are in regular communication with each other. For staffing, they recommend that DHS establishes a safe mechanism for staff to provide input and develop a transparent process for reporting concerns, tracking them, and then ensuring actions get taken. And also to monitor caseworker caseloads, turnover, and other staffing issues, and to improve caseworker staffing and training. They think that DHS should review, revise, and update the current workload model, which they are currently doing, and to develop and implement strategies to mitigate the workload stress factors and implement caseworker teams to respond to potentially dangerous calls. And that's a really big issue. There's a lot of caseworkers that work in rural areas that have recently come out and talked about how they have to go to really dangerous, dark places that are out in the middle of nowhere with no backup. Oftentimes their cell phones don't work. Police aren't able to go with them. So that's a really big concern that is being addressed immediately. And then they also recommend that DHS develop and implement a statewide strategic plan to increase foster care capacity and collect and use data to improve foster care, and to design an internal policy to reduce the risk of hoteling to children. So for some external recommendations, the Secretary of State recommends that DHS work with foster families to remove some of the unnecessary barriers that impede timely recruitment of foster families. They also say that you should build a robust support system to retain foster parents and to reduce the placement instability, and to maintain a culture of respectful communication between foster parents and DHS caseworkers, while committing to build the foster placement capacity across the whole system, which includes behavioral, health-related, and cultural need foster homes. And then finally, to work with other branches like the legislature and the judiciary branch to clearly communicate child welfare staffing needs and the positions the legislature that needs to budget for, and then to advocate more effectively about their different programs. And then also a big issue that they need to continue working on is to make sure they work with DOJ and the legislature to ensure that caseworkers have legal representation in the courtroom at all times. Whew, that's a lot, sorry. So with all these issues, we're clearly in a phase of transitioning and rebuilding, and like I said earlier, it's going to be tremendous work, but there's trust in the new leadership, and hopefully we'll see some of those changes happen quickly. One thing I'm pretty excited to to let you all know is that the legislature did just pass a budget a week ago, and that includes an extra $14.5 million for DHS to hire more staff. So the staff that they are looking to hire is lower level than caseworkers. It's staff that can come in and complete some of the time-consuming paperwork and notes and things that keep the caseworkers in the office instead of out in the fields. So they're hoping that those people can come in. They can help with the paperwork. They can help navigate the system a little better and get youth and foster families and people to the places that they need to go quicker to improve supervision for visits, so more families can have visits, and then help caseworkers get back in the field and working with the families and the children instead of working behind the desk. So hopefully they'll get hired very soon, and caseworkers will be in a better place, and we'll see our system improving. So that's all I have. Thanks.